Good morning. It is my pleasure to call to order the Finance and Physical Resources Committee meeting. It is Tuesday, November 2nd at 8:30. I'd like to welcome fellow commissioners, staff, guests, and those watching online. We love to see interest in what goes on with local government, so thank you so much for taking your time to come to the meeting or watch the meeting. With that, I will ask for a motion to approve the consent agenda.
Support.
Okay, we have moved by Commissioner Breavy, support by Commissioner Sparks, and we'll take questions or comments, discussion on the consent agenda. Seeing none, all those in favor, please say aye.
Aye.
Opposed, same sign. The consent agenda passes. That brings us to item number 2 from Kent County Community Action. Al, would you please read the action request?
Yes, action requested. Recommend to the Board of Commissioners to accept and appropriate $333,000 to the 2021-22 Kent County Community Action Fund for the Refugee Resettlement Food Assistance Grant contingent upon execution of a contract to authorize the board chair or designee to execute the grant agreement, approve extensions, amendments, and increases to the grant appropriation not to exceed 15% of the original award. The Michigan Department of Health and Human Services has made $333,000 available in funding for Kent County Community Action to administer the Refugee Resettlement Food Assistance Grant. The Refugee Resettlement Food Assistance Grant will be managed by Kent County Community Action through an agreement with MDHHS. The program will assist with meeting the nutritional needs of refugee families by providing cooked, culturally appropriate, individually packaged frozen lunches and dinners. The grant term is October 1, 2021 through September 30, 2022. Assistant Corporate Counsel will review and approve all documents as to form prior to signature.
Thank you. Is there a motion to approve?
Support.
Okay, moved by Commissioner Sparks, supported by
Support.
Commissioner Womack. We will take questions, comments, and discussion. Commissioner Bukowski.
Thank you, Chair. Just more from a curiosity perspective, definitely support this. Just curious on the number of refugees we think we're going to be getting. A lot of times, I start reading a agenda item and it sounds really cool, and then we get a $12,000 grant, and it's like, all right, it's not worth the paperwork, but we're going to do it anyways. And here it's like, well, this is really cool, and it's $333,000. That sounds like a lot of food. So are we going to get a lot of refugees? Again, which would be a cool thing, but please.
Come on up, Susan.
Good morning, everyone. We are expecting about 320 families to be arriving in West Michigan. And so we're not only servicing the ones in Kent County, we'll be servicing Ottawa, Muskegon, Allegan, and Kalamazoo counties as they arrive. Well, it's a regional effort, but we're the only ones that, right? And then we've already cooked about 1,000 meals and distributed 500. And we're working with Samaritas and Bethany Christian we know about 2 weeks in advance. Ready to go.
Commissioner Morgan?
Yeah, thank you. Good morning. I don't know much about this program, but these refugees are fully vetted, right? When they're coming into our community?
Yes, they have been at a military camp. Most of the ones that we are receiving are in Washington, D.C., and they're being vetted there by authorities. But there's additional vetting that's going on once they're placed in the housing, once they come. Vaccines, those types of issues, and eyes.
Could you just pull the mic a little bit closer to you? Because if you don't talk into the mic, it doesn't pick up.
Oh, sorry.
Thanks.
Yep.
Commissioner Antor?
Thank you, Chair. I'm not really familiar with this program. Is this something that we've been doing for the last 50 years?
No, this is for the Afghan refugees, and so it is a new initiative. It will probably just be a one-time initiative. It says that we're going to go through September, but the families should be arriving in the areas by December or March. it depends on the vetting process where they are.
Okay, so this is different than the refugees that have been coming up previously into the Grand Rapids area.
Yes.
Thank you.
Anyone else? All right, seeing no other questions, all those in favor, please say aye.
Aye.
Opposed, same sign. That motion passes. That brings us to item number 3, also from Kent County Community Action. Al, would you please cover the action request?
Yes, recommend to the Board of Commissioners to accept and appropriate $38,182 to the 2021-22 Kent County Community Action Fund for the Interurban Transit Partnership Program, ITP, contingent upon execution of a contract to authorize the board chair or designee to execute the grant agreement, approve extensions, amendments, and increases to the grant appropriation not to exceed 15% of the original award. The Interurban Transit Partnership Board has made $23,713 available in funding for Kent County Community Action to be a partner in a Michigan Department of Transportation Specialized Services Operating Assistant Grant to support specialized public transportation. The Interurban Transit Partnership Program is operated by Kent County Community Action through an agreement with the Interurban Transit Partnership Board. The program provides public transportation services primarily designed for persons with disabilities who are 65 years of age or older and who reside in Kent County. 3 ITP-operated transit buses were sold at auction during fiscal year 2020. Proceeds totaled $11,300, which is being made available to KCCA. The grant term is October 1, 2021 through September 30, 2022. Assistant Corporate Counsel will review and approve all documents as to form prior to signature.
Is there a motion to approve?
So moved.
Moved by
Support.
Commissioner Breve, support by Commissioner Sparks. We'll take questions, comments, and discussion. Commissioner Breve.
Yeah, I just have a question. So it says here that the buses were sold at auction last year. Is this gonna be purchasing additional buses for this amount of money? Or, and also, what is the specialized public transportation?
The specialized public transportation is just a grant that we have that is out of the 6, not the greater 6. And so we do out-county specialized services for those who are persons with disabilities or persons that are elderly. And so we provide door-to-door service for them. And then the purchase money that we receive is program income. And so it doesn't go towards the purchase of any other buses. We usually get a grant each year for about $200,000 to purchase buses, because it's a rotation that the buses are on, like a 5 to 7 year rotation of age and wear and those types of issues. And so that money will just help us run that program.
Okay. So this is only for people who are 65 and older, and is it taking them to appointments, like medical appointments or jobs or?
Yes, this year we're going to prioritize medical appointments due to the COVID situation, and because we're receiving the funding that we're receiving is allowing us to receive more per mile than we did in the past. And so I think we have one person who has disabilities that we do give rides for work. And he's been with us probably years out of this grant. But most of the time it will be medical appointments, dialysis, and dental.
Okay, anyone else? Commissioner Bukowski?
So, this is program support for what's to say known on the street as Kent Community Transit?
No.
Well, this is something different?
Yes, this is our grant that we've had for over 2 decades, and we provide rides in addition to the RideLink program that we operate, we provide rides to those who aren't in the major 6 and throughout the county. So most of the people that we provide rides to in this program come from like Sand Lake, Cedar Springs, a couple of Rockford people, and then it's it's door-to-door service.
All right, thank you.
Hey, anyone else? All right, seeing no other questions, all those in favor, please say aye. Aye. Opposed, same sign. That motion passes. That brings us to item number 4 from the Health Department. Al?
Yes, recommend to the Board of Commissioners to appropriate $136,794 for the 2021-22 Health Fund budget and to authorize the Board Chair or designee to approve extensions, amendments, and increases to the grant appropriation not to exceed 15% of the original award. The Health Department has received funding from the Ready by 5 Early Childhood Millage Services for the Fetal Infant Mortality Review Program in Kent County. The award is for 2 years, beginning January 1, 2021 through December 31, 2022. $125,043 has already been appropriated in the 2021 Health Fund budget. This request is to appropriate the remaining $136,794 to the 2021-22 Health Fund budget. Kent County's FIMR program will closely follow the model as established by the state of Michigan. The Michigan Department of Health and Human Services describes FIMR as an evidence-based process of identification and analysis of factors that contribute to fetal and infant death. FIMR complements other studies of infant death, but uses an approach that is community-based, action-oriented, and designed to bring together local health providers, consumers, advocates, and leaders. The FIMR coordinator will utilize the network of connections formed by Ready by 5 to provide greater awareness of data surrounding child deaths in Kent County to contribute to better preventative and intervention activities for children aged 0 to 5. Efforts would be targeted to identify significant social, economic, cultural, safety, health, and systems factors that contribute to mortality and to design and implement community-based action plans founded on the information obtained from the reviews. The funding will be used to support the costs of the FIMR coordinator, supplies, travel, and overhead costs. The award period is January 1, 2022 to December 31, 2022.
Thank you. Is there a motion to approve?
So moved.
Moved by Commissioner Wooden, supported by Commissioner Breve. We'll take questions, comments, and discussion. Yes, Commissioner Antor.
Thank you, Chair. I had a question about, I'm not familiar with fetal infant mortality review. What are we trying to accomplish through that review process? Good morning.
Good morning.
And this is kind of a touchy subject. I'm trying to figure out at what point do we consider prenatal or whatever viable, where it matters.
Yeah, okay. In terms of the fetal infant mortality review, in order for a child to qualify as having been a live birth and then having deceased, they have to have taken one breath. So some of the babies that die are literally only a few minutes old, and that goes all the way through their first birthday. They would qualify in fetal infant mortality review.
Okay, so this is nothing pre-birth.
It is not.
Okay, thank you very much.
Yes, Commissioner Wooden.
Thank you, Chair. Just in terms of that first breath to first birthday time period, how much of the preventative work in the past has been on prenatal care, and how much is more postnatal care, like safe sleep practices?
A significant amount is focused on prenatal care because we know that the number one cause of infant mortality is congenital birth defects. And so if we can help keep that mom healthy and have adequate prenatal care during those 9 months of pregnancy, or hopefully get them to 9 months of pregnancy, then we are going to significantly impact the infant mortality rate. So that is a big emphasis. Once the baby's born, we continue to support through that first year of life.
Thank you.
Commissioner Bukowski.
Thank you, Chair. So how is this woven into, is it part of the overall process? Like when we, I think it was back in August or so, when we approved the Spectrum Health Foundation Strong Beginnings or Early Something, we have a lot of programs with similar sounding names.
Yeah.
And are all those programs like into one statistic? So when we look at, for example, racial disparities in infant mortality, all of this data and effort gets boiled into one chart?
Yeah, absolutely. In fact, one of the great values of the fetal infant mortality review is that it informs all the other programs. So we are driven by this data to know what interventions we should implement, what should we be doing to help make sure that babies are born full-term, healthy weight babies with minimal exposure to things like substances and alcohol and other things prenatally, and then have that safe first year of life. The fact is that fetal infant mortality review does not provide services, but it informs all kinds of other services, including services outside of the county and in services in my division within the county.
Hey, anyone else? All right, seeing none, all those in favor, please say aye.
Aye.
Opposed, same sign. That motion passes. That brings us to item number 5, also from the Health Department. Al?
Recommend to the Board of Commissioners to approve the Lakeshore Regional Entity, LRE, Memorandum of Understanding for 2021-22, accept and appropriate $89,463 of the 2021-22 Health Fund budget for the LRE COVID-19 Block Grant Supplemental, and authorize the Board Chair or Health Officer and/or designee to execute the grant agreement and approve extensions and amendments. The Board Chair or designee may also approve increases to the grant appropriation not to exceed 15% of the original award. The LRE COVID-19 Block Grant Supplemental Funding will provide for the expanded delivery of the Botvin Life Skills training to middle and/or high school students. In addition, funding will be used to develop an adult-use marijuana messaging campaign. Botvin Life Skills is a research-validated substance abuse prevention program proven to reduce the risks of alcohol, tobacco, drug use, and violence by targeting the major social and psychological factors that promote the initiation of substance use and other risky behaviors. Funding will be used to expand the training to schools with a low socioeconomic population where life skills is not currently offered. An additional 10 cohorts will be offered. The Health Department will also use the funding to implement a media strategy to increase awareness about the dangers of marijuana use in driving. Various media outlets will be used to deliver the campaign messages to reach the targeted age groups. The funding will be used to support existing Health Department staff, supplies, promotions, and indirect costs. The grant award period for the LRE Memorandum of Understanding is October 1, 2021 through September 30, 2022. Assistant Corporate Counsel has reviewed and approved all documents as to form prior to signature.
Thank you. Is there a motion to approve?
Motion.
Okay, we have moved by Commissioner Womack, support by Commissioner Brevy, and we will take questions, comments, and discussion. Okay, seeing none, all those in favor, please say aye.
Aye.
Opposed, same sign. That motion passes. That brings us to item 6, also from the Health Department. Al?
Okay, I have some that ended up on the back. Okay, are we on?
We're on the National Association County. This one?
Yep, got it. All right. Recommend to the Board of Commissioners to appropriate $33,200 to the 2021-22 Health Fund budget and authorize the Board Chair or designee to approve extensions, amendments, and increases to the grant appropriation not to exceed 15% of the original award. The Health Department has been awarded $83,000 in funding from NACCHO to approve the Health Department's capability to effectively address the needs of people with disabilities when planning and responding to outbreaks, pandemics, and other national emergencies for the period November 5, 2020 through June 30, 2022. Of the total award, $49,800 has already been appropriated for the 2021-22 Health Fund budget. This request is to appropriate the remaining $33,200 to the 2021-22 Health Fund budget. Funding will be used to continue the contract with the Disability Champion to coordinate activities and ensure that issues impacting people with disabilities are included in planning and response efforts. The Health Department will collaborate with the Disability Champion on implementation and sustainability plans and maintain partnerships that ensure disability-inclusive planning and response efforts. The funding will be used to support the costs of existing Health Department staff to oversee the program, contractual services with the Disability Champion, and overhead costs. The award period is August 1, 2021 to June 30, 2022.
Thank you. Is there a motion to approve?
So moved.
Moved by Commissioner Breve and support by Commissioner Morgan. We'll take questions, comments, and discussion. Yes, Commissioner Bokowski.
Well, in honor of today being Election Day, I'm going to start my abstentions early and often. And so I will be abstaining today as Disability Advocates. My employer is that disability champion that's noted.
Everybody needs a champion.
But it needs a champion.
Okay, anyone else? All right, seeing none, all those in favor, please say aye.
Aye.
Opposed, same sign. That motion passes. That brings us to item number 7 from the Health Department. Al?
Yes, recommend to the Board of Commissioners to approve the State of Michigan Department of Labor and Economic Opportunity, LEO, amendment for 2021-22, accept and appropriate $180,000 for the 2021-22 Health Fund budget for the LEO Refugee Screening Grant Amendment, and authorize the Board Chair or Health Officer and/or designee to execute the grant agreement and approve extensions and amendments. The Board Chair or designee may also approve increases to the grant appropriation not to exceed 15% of the original award. The Health Department has received an additional $180,000 in funding from the State of Michigan LEO to provide a refugee health screen to all newly arriving Afghan refugees under the Operation Allies Welcome Program. It is estimated that up to 350 Afghan refugees may be resettled in the West Michigan area. The refugees will be screened by a Health Department registered nurse for contagious diseases which pose a risk to public health. This screening includes a review of any available medical records as well as documenting of health histories and full body systems review. Vaccinations are administered as needed, and referrals are made to primary care physicians for follow-up based on the findings of the screenings. The Health Department staff also provide health education services that include an introduction to the United States healthcare system and Medicaid, as well as information on healthy nutrition and hygiene. The funding will be used to support the costs of overtime for existing Health Department staff, retiree rehires, temporary staffing, translation services, supplies, and indirect costs. The amended award period is October 1, 2021 through September 30, 2022. Assistant Corporate Counsel will review and approve all documents as to form prior to signature.
Thank you. Is there a motion to approve?
Support.
Moved by Commissioner Bokowski, support by Commissioner Breve. Is there questions, comments, and discussion? Yes, Commissioner Antor.
Thank you, Chair. Hi, Joanne. Maybe you could give me the chronology of this thing. It just seems like we're a little backwards doing screenings after they arrive internally into different counties. Is there any reason why this isn't taking place either, maybe not Afghanistan because of the situation over there, but at least when they first arrive here on our shores to screen people so we're not spreading them all over the country without knowing what they may or may, I mean, what's the theory there?
Well, I'm not sure I understand it completely or can defend it, but I know that when they arrive at the military bases, for one thing, there's very, very large numbers of people, and I think the sheer scope of how many people there are and how many would need to be screened makes it very challenging. And then I think there's probably also an element of they're coming into our community, so our community wants to be responsible to make sure that we know that the people that are coming aren't burdened with diseases that could be communicated. So it puts more control on a local community to be able to guard their local community. So it's probably a combination of both of those. I will say, though, that the majority of the vaccination process, because it is usually multiple vaccinations have to be given, they are begun before they arrive here. And we have records and then pick up. So, for example, if it's a 3-shot series, they got their first dose at the military base before they got here, and then we follow up with that.
Okay, so they do all have at least that
Yes.
first? Okay.
Yeah.
Yeah, I guess it's just, it seems like they're coming here, but generally it's not a direct path, and there's a lot of
Right.
contact along the way before they finally end up on a flight here. So that's it. Thank you, Joanne.
Right. The other thing to add to that, Commissioner Antor, is that we also refer to resources, and those are local resources. So if they're on a military base in Texas, they're not going to know what the local resources would be for someone, for example, with PTSD. we're finding a lot of mental health needs, and so we can directly refer them and do the follow-up to make sure that they're getting the needed resources locally that they need.
Okay, thank you.
Okay, anyone else? All right, seeing none, all those in favor, please say aye.
Aye.
Opposed, same sign. That motion passes. We're on to number 8 from the Administrator's Office, the senior millage allocations for 2022. Al?
Yes, recommend to the Board of Commissioners to allocate $13,937,000 in senior millage funds for 2022 as recommended by the Area Agency on Aging of West Michigan. To approve the agreement for administration of senior millage services with AAAWM and to authorize the board chair or designee to execute the agreement. The AAA of West Michigan holds contracts with 32 agencies to provide services with funding from the Kent County Senior Millage. Under the terms of the contracts, the funding level is evaluated annually based on new program proposals, current year operations, and available funding. In mid-October 2021, the Kent County Senior Millage Review Committee evaluated 2022 funding requests and made recommendations regarding funding for each service. These recommendations were forwarded to the AAA of West Michigan Executive Committee on October 25, 2021, which is now recommending them to the county for approval. The county proposes to enter into an agreement with AAA of West Michigan to serve as a senior millage administrative entity for development, coordination, implementation, and administration of the service delivery system for millage-funded programs for senior citizens. The AAA of West Michigan would receive $627,165 for administration of the millage. Assistant Corporate Counsel will review and approve the Senior Millage Administrative Services Agreement as to form.
Thank you. Is there a motion to approve? Moved by Commissioner Breve, support by Commissioner Womack, and we'll take questions, comments, and discussion. Yes, Commissioner Bukowski.
This is my second abstention today, as Disability Advocates is a provider for senior millage.
Okay, anyone else? All right, seeing none, all those in favor, please say aye. Aye. Opposed, same sign. That motion passes. Oh, that's right, and one abstention. Thank you, Commissioner Bukowski. And that brings us to item number 9 from the Administrator's Office.
Yes, recommend to the Board of Commissioners to appropriate an additional $75,000 to the, oops, nope, I
Nope.
missed one. Hold on, I gotta find my,
We're doing the general appropriation. We're doing our
here we
budget.
go. All right, got it. Okay.
Yeah,
Yeah, just a little.
yeah, let's do the big one and then we'll do the
yeah,
small one.
Only 313 million. So,
Right.
all right. Recommend to the Board of Commissioners to approve the 2022 General Appropriation Act as the official budget for 2022. It is the responsibility of the County Administrator Controller to prepare an annual operating and capital improvement program budget for the county, and the 2022 budget has been submitted to the Finance and Physical Resources Committee for review. Pursuant to state statute, a public hearing on the proposed budget will be held on November 4, 2021, and the appropriate public notice was published. The Finance and Physical Resources Committee has reviewed the 2022 budget in detail. Estimated total appropriations for the various fund types are proposed as follows. General Fund, $199,573,979. Special Revenue Funds, $97,565,073. Capital Project Funds, $16,676,422, for a grand total of $313,815,474. In September 2021, the Board of Commissioners authorized 1.9671 mills for voter-approved dedicated millages via Resolution 09232193, which has been used as the basis for preparing the 2022 budget. In May 2022, the Board of Commissioners will be requested to authorize a general property tax levy on real and personal property within the county upon the equalized tax roll to support county general operations in 2022.
Thank you. Is there a motion to approve? Moved by Commissioner Breve, supported by Commissioner Sparks, and we'll take questions, comments, and discussion, and we'll start with Commissioner Wooden.
Thank you, Chair. And apologies, these two questions came to me last night as I was reviewing the materials one final time. But they're procedural, so they should be fairly quick. The 2 million that was put aside in the contingency for administrator policy, I appreciated the memo that was provided to us about the position requests that will be coming forward. And the 12 some odd positions that are totaling $900,000 that will be coming back to us, or coming back to the committees. Because we are voting on approving the funding today, will it still have to come back to Finance Committee as a budget amendment to move them into each of their specific budgets? Or
Yes.
gotcha. Perfect. That was my first question. I just wanted to make sure that we're not effectively approving those positions at the committee level by our responsibility. And then the second question, the outstanding 1.1 million that's in that contingency fund, what would also trigger requiring those to come back to us as a budgetary amendment? Or what can the administration expend from those dollars without a budgetary amendment?
Well, we would need to bring back any expenditures to you from the contingency to use budget amendments for that. I should also mention that we did have a number of positions that we just have an amount of money in for the animal shelter. So it would actually be more than the million to actually fund all the positions that we plan to bring to you that are in the memo, so.
Perfect. That's it. Thank you.
Okay, anyone else? All right, seeing none, all those in favor, please say aye. Aye. Opposed, same sign. That motion passes. That will bring us to item 10 from Fiscal Services and the Fire Commission. Al?
Recommend to the Board of Commissioners to appropriate an additional $75,000 to the 2021 Fire Commission Fund budget. The Fire Commission Fund was established in 1942. The Fire Commission is permitted by state statute to oversee the purchase of fire extinguishing apparatus and equipment for 18 participating members on a rotating basis. The law permitting such activity limits the county's contribution to 50% of the cost of such equipment, with members required to contribute the remaining 50%. Custom equipment is funded 100% by the member. The 2021 approved budget for the Fire Commission is $1,391,099. It is requested that an additional $75,000 be appropriated to the 2021 Fire Commission Fund budget, $37,500 from local unit contributions, and $37,500 from Fire Commission Fund reserves. The additional funding will be used for increased fire apparatus repairs, group insurance, and acquisition costs.
Okay, is there a motion to approve?
So moved.
Support.
Okay, moved by Commissioner Wooden, moved by Morgan?
No, supporting.
Supported by Morgan. Oh, moved by Commissioner Green. Moved by Commissioner
Yes.
Green, support by Commissioner Morgan. And now we'll take questions, comments, and discussion. We'll start with Commissioner Morgan.
Okay, thank you, Madam Chair. This is kind of in my wheelhouse. Cal, I have a few questions for you.
I bet Cal has a few answers.
Yes, he does. I'll try. My first question is, this is kind of in my wheelhouse, and for my own industry, I know that we used to get an ambulance built in like 4 months, now it's, a year. Order an ambulance. Repairs have gone off the charts as far as $75,000 enough to meet your needs.
Yeah, I believe so. I'm being conservative, requesting 75,000 because I'd rather not come back again.
Okay.
So I feel that it is covering our needs. Yes.
Okay, and you see maintenance really being a factor. They're just getting, the units are being deployed more on responses, and it seems like maintenance is really going on.
Yeah, there's really two things going on, and maintenance and repair is one of them. That has really taken off. And we have a large fire fleet, And if you lose an engine or have to have an engine rebuild, that's expensive. This year, we've had 2. So we've had significant increases in repairs. And then, of course, as you point out, fire apparatuses, the lead time has shot way out. It's a year and a half or more. In fact, if I bid a fire apparatus now, I don't think I would get any bids. The industry is telling us they can't bid at this point.
And just to let everybody know, my colleagues know, there is a PM program with the county-owned apparatus. With emergency vehicles, this stuff happens. I mean, you lose it. Maintenance up to date.
Hey, Commissioner Antor?
Thank you, Chair. Yeah, since I've been on the fire board, I've been amazed at the job Cal has done, looking out at future contingency plans, just in case type things, and we've always had money in reserves. I don't think since I've been on, we've ever had reached down into the reserves. This may be the first time that I can recall. It's probably happened sometime in the past, but, again, I know, Al, don't be shy here, or Cal. You've done a remarkable job with this board, and every time I think of Cal Brinks, I think of the very best of government, because he's always looking out for how can we make sure we're as efficient as possible. And the level of the quality of vehicles that we're providing all these area departments, and probably the lives that saves, because I can't imagine back in the day when communities were strapped, they might have been rolling with some inferior vehicles that maybe weren't running right, weren't working right, but I'm so appreciative of everything you do, and this is a really small price to pay, which we have in reserves, to fund this, so I just wanted to give you an attaboy.
Well, thank you, but I'm going to turn it back to you. This program is collaboration at its best. It really is. When you look at this program between the county and the member departments and how they work together, this is all about the membership, working with the county.
Yes, Commissioner Wooden?
Thank you, Chair. I'm going to preface my comments by saying I plan on voting for this. I know that the last time we had this discussion, it caused some anxiety.
Not from me.
No, not at all. But in previous discussions, it was asked if there has been any conversations or efforts to see if this is something that that members of the 6 cities could be interested in joining. Has that discussion happened or been broached? Just because I wonder, given the fact that collaboration is such a strong aspect of it, if making it available across the county could even strengthen it.
Well, the answer first is, under the contractual agreement, the cities are not part of the Fire Commission. However, the Fire Commission and its members with the ability to communicate can collaborate. And when I do bids, for example, with collaboration between the members, I will often contact the core cities and work with them as well to see if they're interested in participating in collaboration in procurement. The bigger you are as an entity, the less advantageous it is to become a member. And so that's why you don't see your big townships and some big townships and the cities wanting to come.
Thank you.
Okay, anyone else? All right, I have my own little asterisk on this one because my employer is connected to the group insurance. I will be abstaining from this one. So all those in favor, please say aye. Opposed, same sign, and I voiced one abstention, but the motion passes. That brings us to item 11 on the agenda, which is reports. We have a report for the third quarter from Jeff.
Good morning. Thank you, Chair. Good morning, Commissioners. So I have a very favorable report. Hopefully you all got a copy of it, and I don't know if you have it with you or not, but I'll page through it quickly. A very favorable third quarter report. Revenues are up 7.7%. Expenses are only up 1.7%, and we continue to expect revenues to exceed expenditures for 2021. Some of the major variances, taxable growth is up 4.2%, and that was basically due to the growth in taxable value on our assessed rolls. Our charges for services are up. Recording fees, real estate transfer tax, and park submission fees are all up this year, which are all good things. State revenue sharing was up 2.9 million, and that's because last year they substituted a revenue sharing payment for CARES Act, so it went into a different fund, so they've restored revenue sharing to its original amount, so that reflects in that line item. Interest earnings are slightly lower. Interest rates are near zero across the board, and transfers in are tracking budget. Expenditures up 1.7%. We did reclassify some personnel expenses using CARES money. That's why some of the personnel is down down 4.3% from 69 to 66 million. Some of the items and supplies are up a little bit. Sheriff uniforms, sheriff safety supplies, some vehicle fluids, and maintenance supplies are up in the Parks Department. And then capital has decreased slightly from 1.8 to 1.5 million, and that's due to the timing of vehicle replacements. Moving on to page 4, this is the departmental expenditures. Nothing to note significantly here other than the sheriff weight is down 8.6%, and that's mainly, again, due to the wage reclassifications we did with CARES. Some of the other departments are lower or higher, but that's mainly due to timing. We don't see any really significant issues there. Moving on to the statement of fund balance components, we're at $82.5 million at the end of 2020, and that meets all of our objectives in our policies, so no issues there. Cash balances report, we stand at $98.3 million at the end of September, or 130 days. This is up from $83 million last year, or 113 days, so good report there. And then on the final page, this is our cash flow chart that shows why we have our available reserves. It carries us until our tax collections come in. So with that, I'd be happy to answer any questions.
Any questions on the third quarter report? Yes, Commissioner Wooden.
Thank you, Chair. Given the higher than expected net revenues, what are we expecting to be potential fund lapse or appropriation lapse at the end of the year? What are we expecting to be that net beyond what would be needed to keep our 40% fund balance requirement?
I haven't done a detailed calculation on that. It's a little early. I anticipate, we always tell the rating agencies we hope to end at least $2 million positive. I expect to be higher than that this year with the transfer from the CARES. But there's a lot of moving parts yet in this fourth quarter, so we'll do a more detailed estimate later in the year.
And if I may ask, I'm seeing, I'm looking at the comparison between the charts on page 5, or the statement on page 5 and the chart on page 7. And it says we had a fund balance of $82.5 million at the end of 2020, but our cash balances were slightly higher than that, probably closer to in the mid-90s.
98.3, yeah.
Yeah,
correct.
what's that delta? Is that non-fund balance or?
The $82 million is at the end of FY 2020. That's what the audited number was, 82.5. So, and the 98 is where we stand year-to-date 2021.
No, I'm talking about I'm looking at the line with the circles to indicate 2020 available to meet cash flow requirements. We were slightly in the mid-90s at the end of the year, at least by the chart. So I'm wondering which.
I'm still not understanding your question. I
So,
apologize.
If the statement says that at the end of the year we had $82.5 million in the bank for our fund balance
At the end of 2020, correct?
at the end of 2020, and
Yep.
if this graph shows that at the end of 2020 we actually had over $82.5 million, we had closer to $90 million. Where's that delta, or is that the difference between unaudited and audited?
To get back to you on that, I'm just looking at the chart. Yeah, it looks to, Marvin, do you have the answer on that or no? Back to you. Not all the fund balance.
So essentially, there's cash that's included in that amount is fund balance plus additional
Plus other
cash.
stuff, yes.
Gotcha.
Thank you, Marvin.
Gotcha. Thank you.
Commissioner Morgan.
I can't build off the hook here. Morning.
Good morning.
Nice snapshot in time.
Yes.
Nice third quarter, but it is a snapshot, right?
That's
So
correct.
what I thought I heard you say is you expect to be just a little bit up from your projection, right? So we'll see how the fourth quarter plays out, but certainly like this snapshot in time.
Very positive.
Thanks.
Okay, Commissioner Bukowski?
Thank you, Chair. But that, looking at the shot on the bottom of page 2, as was numbered in your report, page 64, and yes, I understand there's a lot of moving parts in the last 2 months of this year, or 3 months since this is September 30th. Didn't last year we have a significant transfer to the strategic capital so that, where it shows our actual 2020 was a positive 1.7 million, that is, but wasn't there actually more net revenue, but we did a transfer out to other funds? And so, like, are we anticipating a similar action in December?
That transfer occurred earlier this year, if my memory serves me correctly. I think you're talking about the $5.5 million we moved to capital.
Right.
I believe that was earlier this year, so we have not closed, that would be part of this year's closing. I remember, like, we did it March.
Okay. I mean, it just seems like we're significantly further ahead of last year at this time, you know, almost $9 million.
$5.5 million of it was indeed that transfer that was done earlier this year.
Okay,
So that would be in that number.
okay. And that, but it hasn't, that $5.5 million hasn't been shown as expensed. It was just, it's like moving off this page into a fund.
Correct, yeah, we took it out of the payroll expense, so
Right.
it's showing as a net positive here.
Okay. All right, thank you.
Okay, anyone else? All right, thank you, Jeff, for that report. That will move us to item number 12, which is public comment. Is there any public that would like to address the Finance and Fiscal Resources Committee this morning? You'll have 3 minutes. Please state your name and address.
My name is Nancy Nielsen. I live at 14130 Keller. It's a Cedar Springs address in Kent County. I am chair of the Kent County Senior Millage Review Committee, the group that was responsible for the $13+ million in appropriations for next year that you just approved. I want to thank you so very much for your support. I guess I was actually rather disappointed that there weren't any questions. I have reinforcements with me. We could have answered any question. But I actually take that as a compliment that you have that much confidence in the work of our committee, that you trust us that much. So we really appreciate that. It's our 24th go at that, so I guess we've had a lot of experience.
We've been at this a long time.
Yeah, we have. We have. I would also be remiss if I didn't acknowledge the work of some of your own colleagues who are on that committee. Commissioner Steck, Hennessy, and Coleman are members of the committee. We all spent a lot of time together in mid-October, as well as Paul Peter from the Administrator's Office are big members of the committee. Looking ahead, I'm sure you're aware that the senior millage is up for renewal next year. It will be the third renewal. And obviously, I'm seeking your support for that as well. We'd all like to be back here again next year. So.
Okay, thank you. Any other public comment? Okay, seeing none, we will close public comment and go to Commissioner Miscellaneous. Is there any Commissioner Miscellaneous this morning? All right, I will just add a huge thank you to our administrator and fiscal staff for a smooth budget. You know, the budget in front of us that we just are going to be sending now to full board is $526 million. So well done for the efforts of everyone, because we have a lot of work sessions, a lot of time, a lot of communication. I know we made that look very, very smooth, but I assure you there's a lot of pieces that lead up to having something go that well for us today. So thank everyone here for the committee for their work and focus on our budget, because as we know, the budget is really the roadmap for everything that happens for the county going forward. And with that, we are adjourned. And the next meeting is Tuesday, November 16th at 8:30.